Hello and welcome to Essential Ingredients. I'm your host, Justine Reichman. With me today is Dr. Edison de Mello for our third part in our three-part series of gut, food, and health. Today we're going to talk about mindset and food and gut.
Yes.
Welcome, Dr. de Mello.
Thank you. It's nice to see you again.
Nice to see you again. And, we're still here. I got my IV in today, and I want to discuss that too, and how that affects mindset, and also the mindset of getting the IV, and how and what we can do so that we can give ourselves the best possible life and not let fear take it over. Now, I know that's a little bit of a detour from talking about food, but I think, what we eat can give us more anxiety. What we eat can, attribute different ways that we respond to things.
Yeah.
So I'd love to start off with just asking you again to just introduce yourself, what you do, and your title for those that are maybe tuning in for the first time.
Great. So I'm Edison de Mello, Dr. Edison de Mello. I'm an MD and the founder and chief medical officer of the Akasha Center for Integrative Medicine. And I'm also trained as a clinical psychotherapist.
It's quite a great combination. I mean,
know.
Body, mind, health, it's all in one. I do love it.
Yeah, thank you.
And I don't find it's very common.
It's not. And for me, I could not see myself being a doctor without that particular training before medicine.
So I know in our last conversation, we started to talk about statistics and the impact of food on gut. So I'd love to just resurface that question and see what staggering statistics you might have on the impact of our gut on mental health.
Oh, great question. So I think we said it before, and I think it was in the first segment, that up to 10 to 15% of the global population have been diagnosed or suffers with IBS, inflammatory bowel disease. And the name inflammatory says it all. That's a staggering number. What that comes up to is 800 million people in the world. And those are people who have been diagnosed. What about the ones who have not been diagnosed? The ones who have no access to medical care, the ones who are afraid of the diagnosis itself. So I think I would, and this is all my personal opinion, I would at least double that number. So that alone is a staggering number. In the United States, we have shown that of cases who have been diagnosed, they amount to about 3 million cases.
Wow.
But this is only IBS. It doesn't cover all the other symptoms.
Within the gut?
Within the gut.
And how many other symptoms roughly are there?
Oh, you can have leaky gut syndrome. You can have SIBO, small.
I had SIBO.
Yeah, small intestinal bacterial overgrowth. You can have candidiasis in your stool that shows that it's in your gut. So it is a slew of other symptoms and diagnoses that you can have out there. But because IBS is the one that is most prominent and the one which has been significantly studied, that's the one that people tend to research and to put numbers to it. The other staggering statistics is that of all people with mental health issues, including depression and other forms of emotional instability, it's been proven scientifically that up to 20% of those individuals have a bad diet. And so the idea is 20%, again, it's a staggering number. If we were to look at those 20% and help them eat differently, I can assure you that those statistically would decrease.
Are there any programs out there that help support individuals to work on their gut so that they can have better results and not have the challenging mindset, it can declutter what's happening maybe in the head?
There are a lot of services that you can find online, a lot of resources, a lot of incredible nutritionists and naturopathic doctors and MDs and many people, either integrative medicine experts, naturopathic experts, as I said, functional doctors, who have been talking about this for the last 3 decades. The only question is they're not tailored to you individually.
Right. That you need to see somebody personally.
And if you can see somebody personally, if you have the ability to invest a little bit in your health, and sadly not all of us can do it, then it becomes more tailored to your needs. The way I explain this is very simple when I do my lectures, right? There's 8 billion people on the planet, and there's 8 billion different fingerprints. So we are not all the same. We may look the same, talk the same, have sometimes the difference, the same symptoms. But there's an individuality to all of our symptoms. And that's why if you have an infection and the person actually has the same infection, one antibiotic may work for you and not for that person.
Right.
Because it's very tailored to your DNA, to your genetics, to what you eat. So all of this leads me to really recommend that for those who can, sit with a professional person and let her or him develop together with you a very personalized eating plan.
What can they hope to achieve in the short and long term by doing that?
The relief of the symptoms. And that's the thing that I see the most here. I think in the last segment I explained that we have a program called the Reset Program. It's a 21-day reset. Somehow, somewhere, somebody decided through observation, it's not scientific, but observational study, that it takes any system 21 days to change, to adapt to change. I haven't been able to find research validating that, but it's out there. We have 20 days detox, 21 day this. So we use it as an incentive to get people started. And in those 21 days, most people will have their symptoms decrease. And then we tell them, can you push for another 1 week, can you double it for 42 days? So symptom relief is incredible, an incredible incentive. And I tell you what, you adjust. We are adaptable beings. If you don't eat sugar for 3 weeks, the next time you ingest sugar, it's going to be too sweet, because we are adaptable. So give it a try. Try to eliminate one of those foods. Go against everything that you believe you cannot do. You can do it, and see what happens.
So I'm curious because, for me, it seems like this is natural. Like, I'd want to do this. I would want to sit down, let's put it together, let's figure it out, right?
Right.
And I'm into it. And I recognize that not everybody has the same resources or the same time or the same ability, whether it's to cook the food, whether it's to pay for it. I mean, there's a lot of different resources one has to do. So I'm wondering, is there something we could offer that makes it accessible for them to do baby steps? Maybe it's not perfect, but it's a little bit better than not doing it.
A great question again. I believe all of us can do it. And some of us are afraid of change. Change is scary.
Yeah.
And also I ask you, before I give you tips, I will ask your listeners to consider the question, what am I getting from eating the way I eat? What am I getting from being resistant to change? It's called the secondary gain. The baby step that you can take, the first one that I think is empirical, is watch your thoughts when you're eating. Are you really dedicating time, even if it's 15 minutes, for you to stop and eat? Or are you on your cell phone? Are you driving? Are you thinking about the next meeting? Because you're releasing hormones when you're thinking about those things. Sometimes you're stressed out and you release cortisol, which is anti-insulin. So be aware of your eating habits. Where do you eat? And do you dedicate time to nurture your body? Or do you eat on the fly just because you have to? The second thing that I would say that anybody can do it, don't eat 100% of the food that you think you need. Stop at 75%. So if you think you need a whole a whole plate of food, stop at 75% and wait 20 minutes. Why is that? Because there's a delayed response from the gut. Your brain tells your gut, prepare for landing, I'm hungry.
It's so true, because when I eat, I'm always like, do I want dessert? I might be full in 20 minutes.
Exactly.
And you know what? I am. Unless it's Chinese food, then I tend to get hungry after 20 minutes. I'm not sure what that's all about. That's a different conversation. But I know what you mean. So I try to do that too. I was out to dinner last night with my dad, And he's like, well, I could really eat some more. I'm like, give it a few minutes.
Exactly.
Give it a few minutes.
And this research actually showing this, that if people wait 20 minutes, 75 to 80% of the time they will not have seconds, because that's how long it takes for the feedback loop to reach your brain. So try to do that and see, how your body responds. And the other thing is, how much water are you drinking? Are you drinking water with your food? Are you drinking sodas with your food? Are you drinking sugary foods with your food? Can you only sip water during a meal if you need to? I usually tell people, drink before or after, because you're gonna bloat. Right?
Is that the reason? Because I've heard that before.
Yes.
That's the reason. Don't drink during the meal because you bloat.
But why you bloat? Because the water will directly, actually, I was going to say indirectly, but it's going to affect your digestion. Remember, you have to have all the salivary enzymes doing their job when you eat, and water will disrupt the system.
So I'm curious. Many times, if you're in a hospital or wherever, you have a nutritionist, and they're like, okay, they give you some mashed potatoes, they give you some vegetables, and they give you a piece of protein, right? It's like they call it a balanced meal, and it has the fruits, the vegetables, the leans, all that kind of stuff. Do you look at that and say, this is positive, and this can promote positive mental well-being and a resilient mindset?
I looked how it's been cooked. I looked at the quality of the food. Yeah, you may have, in a hospital setting, for example, you may have all the needed food elements on that plate. But how is it cooked? Right? If you're overcooking a vegetable,
you have no vitamins.
Right. And if you're draining the water after you're cooking, that's very, rich water, rich in elements, rich in vitamin. But the vegetable itself, it's not useless, but it's not as potent as it could be, right? What meat are you eating? What kind of meat are you eating? I believe that for those of your listeners who can eat vegetarian at least 2 to 3 times a week. I'm not saying don't eat meat. Some people need the meat, right? But to give the body a break, it takes a lot for it to digest meat. And that's why when we eat meat, a full amount of meat, especially red meat, you feel tired. Because your body is expending a lot of energy to digest that food.
Interesting. So do you expend the same amount of energy eating fish and chicken?
No.
Less.
No, you don't. Less.
So I'm curious, and this is a personal question, because I love vegetables, but I find a lot of them are very hard to digest on my stomach.
Yes.
No matter what I do, I always get a little gas from it. Got to be honest, and I'm actually good eating a piece of steak in the morning, like just a slice or two, and a little salad.
Yes.
And to me, I feel fine with that.
Yeah.
Much better than eating, because breakfast, I don't eat eggs because I'm intolerant.
Right.
And if I just eat the vegetables, I have a problem.
I would urge you to try the Japanese breakfast.
Oh, what is it?
It's vegetables, it's brown rice, miso soup, and not red meat, but fish.
Okay, so it's still having that. So I can do the fish.
Yeah, I would recommend that you don't eat meat right after you wake up or in the morning, because your body is still trying to wake up to the fact that you've been fasting for the last 8 hours or 10 hours, however hours you sleep. So to go in and add a big piece of red meat, it may be too much for the system. The same is true for people who eat a lot of bread. Bread, cheese, bacon, the American breakfast. I know.
Or the English breakfast, right? Or the French breakfast.
Exactly.
A croissant, pain au chocolat, apple tartine.
I mean, here's a story. I know we don't know how much time we have, but in medical school, I would go to lectures on cardiovascular medicine. They were sponsored by the drug companies. And guess what they were serving? Bacon, eggs, bagel, orange juice.
They want you to buy their medication.
Exactly. And I would look at this going, wait, is any...
Counterintuitive?
Yeah, is anybody looking at what's being served? And we're talking about cardiovascular medicine, right? So I would say to you, listen to your body. If your body says, I need some more protein in the morning, animal protein, good, listen to it. Now, your decision needs to be congruent with what's best for health. Not for your taste buds, but for health.
Yes.
And certainly fish is much easy digestible than red meat.
So let's talk about the mindset of this, and because it can be very intimidating for people.
Yeah.
And as we eat different foods, they make us tired, they make us anxious, they do all these different things. So how do we bridge the gap to eat the right foods, to have the right mindset, to make it more accessible and less confrontational, less scary?
Yeah. Listen, I think I alluded to this before, and I'm happy to go back there because I think it's very powerful. Your body will tell you what it needs. So if you take a moment to listen without judgment, without, I'm not going to do that, but to be curious about what your body's telling you, you will make the right decision. So that's the first step. Don't make the decision based on what your brain is saying to you. Like you said before, that you tend to eat a little, you get a little hungry when you don't eat, right? A little, what do you say?
Hangry.
There you go, right? So here's a step. Why wait for so long to eat? Sometimes I forget to.
Yeah, that's
but
it.
So I put a little alarm on my phone, on my iWatch, and it beeps like, okay, I have to eat. So commune with your body. It's a partnership, and I'm going to be a little corny here, if I may. There's a time in your life that you become the mother to your body. Because who puts your body to sleep? Who feeds your body? Who protects your body from being hit by a car? So ask your question, would I be feeding my children, if I had a child, what I'm feeding my body?
I think that's a really great way to look at it. And to that end, and my last question is about processed foods and the impact they have on our brain health.
Yeah.
Because we talked before, I think it was in another segment, about the supermarkets. And one comment that I've often heard is, buy the outside. Buy the outside. It's the fruits, it's the vegetables, it's the things that are fresh.
Exactly.
Okay. And then in the middle is all the processed stuff. But
Yeah.
people do include processed foods. I mean, I don't like to. I prefer to make my own. But you know, what do we see? What do we see processed foods and refined sugars in terms of how does that negatively impact the brain function and mental health?
Read the label.
Read the label, because in my mind, they're creating inflammation. They're, they create stress, deregulation, all these different things.
Yeah, read the label. By law in our country, you have to list the ingredients of all foods, even for foods that are imported. Take the time to read the label. If there's food coloring there, if there's food preservatives more than once or two, sometimes they have to. If there is added sugar, ask yourself, would I feed my child this?
I won't eat it. Never mind.
Exactly. No, remember I told you the analogy. You become the mother or the father. So ask yourself that. Read the label. It's impossible in the 21st century for me to say to your listeners, don't ever eat processed food.
Right.
Remember, we talked about, I think it was in segment 1, that we need to be realistic to the message that we're giving to the patient. Who is that patient? Where is she or is he at that moment? So be realistic so that you're not going to lead to her or him feeling like they failed. So don't say don't eat processed food, but tell them, read the label. And if there is a lot of
so basically, top 3 things you want to tell them they should look for.
The amount of sugar, okay? How much? What's the word? How many preservatives? Different preservatives are in there, right? And how much of processed wheat is in it? Now, wheat is everywhere. But it's not that wheat is a problem, it's how long it takes to process the wheat. In this country, farm to table is 3 years.
Wow.
For wheat, in most cases. In Europe, it's 3 months.
And interestingly enough, I don't know if I mentioned to you, when I was in Europe, I ate a croissant, I didn't feel bad. I ate all sorts of things that I didn't eat here, and I felt fine.
Most people who have gluten sensitive intolerance, not gluten, not celiac. Celiac disease, forget it. But if you have gluten intolerance or gluten sensitivity, most of them do better with a zero, I think it's called zero flour, something, which is the flour that's less processed, that it's in the ones that they use in Europe.
So if there's one thing you wish your patients knew that they could do that would make a really big change for them and that was easy, what would it be?
Great question. I think I've been saying that, but I will, in this segment also, but I will say it again, Justine. Listen to what your body needs. It's going to tell you. Not your brain, not your taste buds. Number one. Number two, as a doctor, as a previously trained therapist, watch your thoughts. What is the first thing that you think when you wake up in the morning? Because that's going to influence your decision-making process in everything that you do. How you're going to arrive at your job, what kind of breakfast you're going to have, what kind of day you're going to have, your thoughts. So what are the thoughts that you have in the morning, and what's the last thought that you have when you go to bed? Those things influence your decision. And then listen with curiosity. Don't be judgmental, but be curious about, I wonder what it would be like for me not to eat steak in the morning anymore, or maybe just once in a while and switch a little bit to salmon, to seafood on some level. What it would be like for me to really, crack this up and not drink any sugar or eat any added sugar for the next 3 weeks. I can do this. And then see what your body's going to tell you. In other words, be curious.
I like that. Be curious. And I think that's so important because you're being curious about what you're putting in your body that you have control over. You're having control over the choices you make around the processed food, having an education and knowing what to look for.
Exactly.
You've given people tips. I'm so appreciative.
Yeah.
So I think that if we consider what we're eating and how it makes us feel and think anti-inflammatory, we have a chance to live the best possible life.
Right. And then you understand that we are hormonal beings. Everything about what we do is hormones. And hormones, be it, your sleep hormone, your hunger hormone, your feel happy hormone, it's all influenced by what we eat.
So, now we're finishing off this drip that I had here. And we gave you the phosphatidylcholine to help with my brain. And what else did you put in here?
Myers cocktail.
And what was that for?
Myers cocktail is a combination of all the essential vitamins that you need to be able to have a really strong immune system. So you got vitamin C, you got calcium and magnesium, you got a little bit of zinc, you got B complex in there, and you have something called glutathione, which is the most amazing antioxidant that there is. All of this is geared towards decreasing the inflammatory burden in your body.
So it's a group effort. It's your food and it's your supplements and understanding how they work together, because when they work on their own, they may have they may help you in some way, but putting it together really is the power move.
Exactly. I would add two more things to that beautiful summary that you created. It's your food,
and your mindset.
It's your mind. I would say it's also who do you go to when the rough gets going?
Your support system.
Who is your support system? What do you turn to? What is your belief system? And do you believe you are somebody who can make changes? So I would add that.
Thank you, Dr. de Mello. Thank you so much for joining us in this series about food, gut, health, mind.
Yeah.
I think it's really been eye-opening for myself, and I will continue to come back and get more of these so that I can see how they impact my mental health and in particular, my memory.
It will be a pleasure to have you back.
Awesome. And for those that want to tune in and want to hear more from Dr. de Mello or learn more about what he does, check out his center.
AkashaCenter.com.
Perfect.
And also the book that I've been talking about all along. It's called Bloated.
Bloated. We're going to add a link for the book Bloated. You'll be able to get it.
Yeah.
And it's a great read, and it's really cute. I want to hear what you guys think. Tell me what you think is on the cover. Thank you, Dr. de Mello. I'll see you again soon.
Thank you for having me.